Hey guys, it's Sally here from Strength to Dance and welcome to Mobility Monday. Today we are going to be looking at ball releases again. This time the area we're looking at is the hip. So we'll have a look at the back of the hip and then maybe move around to a little bit at the front into TFL or tensor fascia lata. So remember, when you're doing your ball releases, you want to make sure that you are fully melting around the ball. You are accepting the ball into your tissue. We don't want to be vigorously rolling around because this excites the system, and we're normally looking for some kind of release, parasympathetic response, a drop down within the system. If you find something that is particularly tight or sore, just spend a little bit more time there. You can spend a couple of minutes on the one spot, breathing, using your mind, letting it melt and relax. And then you can move along, have a little bit of a travel around somewhere else in the back of the hip. The hip ball review we're going to do today, I'll just do one hip, and we're going to be quite precise with the landmarks that we're actually working on. Again, remember, you want to test, do the work, reassess. So this is going to help you with things like increasing turnout. Maybe if you have a hip injury, this is going to help with allowing the hip to center within the socket. Or maybe you've done a really hard class and you're sore, a little bit like I am today after last night's hip hop, and you want to do a ball release to help your body feel good again, get rid of those dots or delayed onset tissue soreness. All right guys, off we go. So today I'm going to be using this blue spiky ball. Again, it's totally up to you what you use, but if you do use a spiky ball, I would probably make sure you're doing it over clothes. We're going to start off at the back of the hip. Now we're going to be looking at piriformis. So that comes off the base of your sacrum, sort of, and travels around to your greater trochanter. I'm then going to move to glute med, which is a little bit more at the side here. Comes off this bone and up to the top of the pelvis. We're then going to be looking at deep hip rotators, but we'll change our position there. All right, let's do this. So I'm going to lie on my back, ball here, lift and place down. And I might just need to have a little wriggle around till I find the spot. Remember, you've got the bone of your sacrum. Piriformis comes off. Piriformis can be quite a small muscle in a lot of people, almost ligament or tendon-like. Now I'm melting in near to the bone of my sacrum, sinking, sinking, sinking. And then I'm just slowly dragging, so I'm moving my pelvis over towards the outside of my hip. And then I come back in again. Repeat, sink down, melt, accept the ball into my hip, and then slowly move. Remember, whenever we're doing our ball releases or foam roller releases, whatever, we need to do it with attention and intention. So my attention is going to be on the muscle I'm using. My intention is, what do I want to happen? I want this to really melt, ooze and release. Now I could stay here for a long time. I could even add in a little leg opener like this. That helps the tissue sink and stretch again. Sink and stretch. But I'm going to move up now to glute med. So that's a little bit higher and round to the side a little bit. And I'm going to sit there. Now I often have trigger points here, so I could stay here for days. I'm not going to for the sake of the video. Nobody wants to just watch me releasing my trigger points all day. Knee in and out. I like this one, the knee addition. You might want to bring the knee up and down. Again, note how slowly I'm doing this. I'm not whizzing the leg around and rolling around on my ball really quickly. Really slow, melting in. You can come up a little bit higher on your glute tissue. You can get some areas, gnarly areas at the top of glute max. So that's just where it joins the pelvis. Then we're going to come around to look at TFL. TFL is one of those muscles that attaches onto your IT band or your iliotibial band. Tensor fascia lata tenses that lateral fascia. Now if you find your bony landmark here, which is your pelvis, and you just pop to the side of it, a little bit like where your hands come into your pockets. And again, we're going to rest just here. Melt. Have a lot of weight on your hands and your feet. So really support yourself and lower yourself onto the ball. Remember guys, we're working here, not here. Do not come into this area of the hip. Very fragile. We have a lot of nerves and blood vessels here. Inguinal ligament. You don't want to be in what's called the femoral triangle. Don't want to be in that area. Okay, we're going to look now at our deep hip rotators. So if you remember, anatomically, they sit between your sitting bone and the outside of your hip in a fan area here. So quite an easy way to get into it is actually sitting on the ball like this. So I've got the ball on my sit bone and I'm just going to pop off to the side into sort of like a valley or gutter between my bottom bone and the side of my hip. And I'm just going to melt in here. Again, accepting the ball, accepting the release. I could then do a very slow little travel around, like a rainbow shape or a half moon, coming from the side of the hip towards my back passage. Be careful here. So I'm making a little circle like that around at the back, coming into my deep hip rotator fan. Check out your theory page, know your anatomy. So we don't want to be just doing releases willy-nilly. Try and know what structure you're on. Okay, so we had TFL, a little bit like where you put your hand in your pockets. Glute med, glute max, upper glute max, piri, and deep hip rotators or turnout muscles. Once you've done your releases, you have created space and you can then go to look to do some of your isolation work. We often start with a lot of this when we're working with our dancers in clinic before we start doing turnout training. Again, like I said, if you've had a hard class, your hips are sore, this would be good to do at the end of the day as well. So you can use these releases before or after class. We want to just bear in mind as well with these releases that you don't necessarily need to release the whole body all the time. And if you have an area that might be hypermobile or injured, your muscles might be upregulated to splint the area, so you don't want to release it. It's doing the right job for that moment in time. So pick and choose where you're doing your releases. If in doubt, go and seek help from somebody. If you're here in Sydney, come and see me. Thanks guys, I hope you enjoy that hip release.